What if I told you that the decline in American health isn't really about what we eat or how much we exercise? What if it's actually about decisions, deliberate choices, made in the halls of power? Well, today, we're digging into a pretty provocative argument from one of the world's top medical journals that claims exactly that. It's a question that's kind of baffling, right? You've got the wealthiest nation on Earth, and yet, by many measures, its people are getting less healthy. How is that even possible? We're going to try to unpack this mystery by looking at a perspective from a doctor who thinks he's found the answer.
So, the source for this whole discussion is a viewpoint published in the highly respected Journal of the American Medical Association. You might know it as JAMA. And in it, the author, Dr. Stephen Wolfe, makes a really bold claim that specific intentional policy choices are a main driver of this health decline.
All right, so first, let's explore the core argument here. This direct and maybe often overlooked link between what the government does and how healthy its citizens are. And wow, the title of Dr. Wolfe's article, it really doesn't pull any punches. The whole idea is that this health decline wasn't some accident or an unfortunate side effect. It was, according to him, a direct result of policies that basically ignored population health.
So take a look at this. The article lays out this incredible contrast. On one hand, you have the things public health experts have been recommending for years. And on the other, well, the policy actions described in the article were often the complete opposite. Slashing healthcare funding, weakening regulations, and cutting back on social programs that are often the very foundation of a healthy society. Okay, so let's break this down. We're going to get into the specific areas where the article claims these policy choices had a direct and damaging impact.
The first piece of the puzzle, according to the author, is health and social policy. You can think of this as like the bedrock of a healthy society. All the systems that give people access to doctors, support education, and make sure there's some basic economic stability.
The author points to a jaw-dropping number, over $1 trillion in proposed cuts to Medicaid. Now that's a key program that gives healthcare to millions of low-income Americans. It's a truly staggering figure, and it's not just some abstract number on a page.
And a number that big? Well, it has devastating real-world consequences. Dr. Wolfe argues that a direct result of these kinds of cuts was the closure of rural hospitals, which left entire communities with way less access to medical care, or in some cases, none at all.
All right, the second big area the article digs into is something the author calls undermining science. Now, what does that mean? Well, it refers to actions that weaken the very institutions that are designed to protect public health, the ones doing the research, collecting the data, and giving expert advice.
I mean, just look at this list. The source claims that a whole bunch of really critical public health programs were just gone. We're talking about the systems that track diseases, work to prevent smoking and chronic illness, and research everything from injuries to mental health.
To make this really concrete, the article walks us through a specific chain of events with vaccine policy. It lays out a sequence. First, experts on an advisory committee were replaced. Then, key vaccine recommendations were reversed. The alleged result? Vaccination rates fell, which was followed by a record-breaking resurgence of a preventable disease like measles.
Okay, the third piece of this puzzle is deregulation and something the author terms data obscurity. And that really boils down to two things: rolling back rules designed to keep people safe and just stopping the collection of the very data that tells us how healthy we are as a nation.
And according to the article, the consequences here are, well, pretty direct and predictable. If you weaken safety regulations, you get more injuries at work. If you stop collecting data on a problem like hunger, the problem doesn't vanish. It just becomes invisible to policymakers and to us.
But this story doesn't just stop at the U.S. border. The article argues that these choices created ripples that were felt all around the world.
Get ready for this number, 14 million. It's a shocking figure, and it really needs some context to sink in.
So, what is that? 14 million is the article's projection for the potential number of lives lost globally by 2030. Dr. Wolfe connects this staggering figure to two major policy areas: big cuts in U.S. humanitarian aid and rollbacks of environmental policies tied to climate change.
So after all this, the article doesn't just end on a down note. Actually, it finishes with this really powerful call to action. It frames this entire issue as a matter of transparency and, really, the public's right to know.
This quote really sums up the whole argument, that central cause and effect logic. The author's point is pretty straightforward. When a nation decides to scale back its health protections, it shouldn't be surprised when it gets bad health outcomes. Policy isn't just abstract, it has real, tangible human consequences.
So what's the answer? The article puts the responsibility squarely on the shoulders of scientists and health professionals. It calls on them to protect our data, to analyze the health impacts of policy, and, maybe most importantly, to communicate what they find clearly to both lawmakers and the public.
And really, what this all comes down to is a core principle from medicine, something called informed consent. You know, a doctor has to tell you the risks of a procedure before you agree to it. The author is applying that exact same logic to public policy, arguing that citizens deserve the same courtesy from their government.
Which leaves us with this final, really critical question to think about. If a policy choice comes with a potential health price tag, one measured in well-being and even in lives, do citizens have a right to know that cost up front before they're asked to give their consent? It's a powerful question about transparency, critical thinking, and the true cost of policy.